Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us right now, we are getting our second conversation started. And we are speaking all about the Gift of Life Pediatric Cardiology Clinics. And here to discuss that, we have Ariel Mitchell, who is the chairman of the Rotary Gift of Life Belize Committee. We also have Jeffrey Delaney, who is a pediatric cardiologist. Leroy Swedlund, who is a Rotarian of the Omaha Rotary downtown. And we also have Yvette Burks, who is a Rotarian and a member of the Rotary Gift of Life Belize Committee. Good morning, everyone, and thank you for joining us.
Good morning.
Good morning.
So this is, of course, a really interesting initiative, but perhaps for some of our viewers who don't know, Ariel, why don't you tell us all about what the Gift of Life program is all about?
Well, the Gift of Life program is a flagship of the Rotary Club of Belize. It is primarily targeting children with congenital heart disease. Usually we would have about 2 clinics per year. Unfortunately, last year we only had 1 clinic, and because of the COVID pandemic, the rest had to be postponed. At that time, we had several children who were scheduled to travel abroad for treatment. That was put on hold because of the borders being closed and so on and so forth. So we're so happy now to have the program back online to some extent, because there are a long list of children who are waiting for medical attention.
Now, how long has this program been running?
Yvette, this program has been going how long?
Well,
Yvette?
we were not Rotarians then, but we understood since 1977.
Wow. And it's a really critical collaboration. I think it's understanding the capacity that we have in country. While you can get some cardiology care, when it comes to pediatric specialization or special needs for children, that's where very often we fall short.
That's
Exactly
correct.
So.
Yeah. Yvette, tell us a bit more about that, being able to have children access care here.
Yeah, so thanks to Dr. Delaney, actually, and the visiting teams, we can do some limited things here when COVID situation allows. However, for the most part, the more complex cases we need to be sending out. And as we already mentioned, COVID, of course, shut us down for at least a year.
Yeah.
But about 3 or 4 months now, a few of our locations abroad started accepting our children again. But unfortunately, they are unable to accept the Belizean children because the cardiac surgeons are not even able to take these patients into cardiac conference to discuss treatment, much less ask the administration for a charity waiver. And so this clinic is extremely important because to be able to get a child the surgery that he or she needs, we need to have a proper screening and evaluation done that's not more than 6 months old. And the video image of the heart echo examination needs to follow exact protocol and be able to be viewed by the cardiac surgeon so that the child can potentially be accepted for treatment. So the value of this of this clinic cannot be underscored. It's critical. It's a big deal for early to Belizean children.
Dr. Delaney, tell us a bit about children who have these types of cardiac problems. Why do they develop it? Is it something that they're born with? And what's the prognosis if you're able to check in and detect it early?
Right. Thank you for having us on this morning. The answer to the question is actually both. Most of the children are born with the problem, but we also see children with rheumatic disease or secondary infections or problems with the heart that have come up over the course of their life. But most of the children are born with the problem, and then how well they do is quite variable depending on how severe the condition is. You can have children that have something that we follow along to make sure that their status is stable, but they really have no limitations and they can function and perform quite normally. Yeah. And then we have children that have hearts that are seriously malformed and need to have at least one, if not multiple, heart surgeries to correct or to make what they have as functional as possible so that they can have as good a life as possible, even if a cure isn't really a functional outcome for them.
What's the most common cardiac problem we see in children in Belize?
I think there's probably two that come up most often, and that would be small holes in the heart. Small holes in the heart are very common. If you consider all holes in the heart, of just an area where the muscle didn't quite grow all the way together and there's an opening between the pumping chambers, that's quite common, probably just less than about 1 per 100 births. And then there's also bicuspid aortic valve, or a valve that has 2 leaflets instead of 3. That's quite common and sometimes doesn't get recognized until later in childhood or early adulthood because the valve functions well for the most part. We have to watch all of those children, and then we have a long list of much more severe diseases that can impact you even as a newborn infant.
Yeah. Now, Leroy, let's shift focus to this collaboration between the Rotaries and what it's been like to maintain this relationship for as long as you have.
The Rotary Club of downtown Omaha really values the participation and the cooperation of the Rotary Club here in Belize City. Without that, the program wouldn't be successful. But we look forward to coming down at least once a year and having clinics. This year, because of COVID, we actually extended it from 3 days to 5 days. Yeah. But normally it's 3 days. In the past few years, we'll spend another 2 or 3 days where Dr. Delaney actually does some pediatric heart catheterization here in country. So we're always hopeful that we can come back and do that versus having children travel to somewhere like Cayman Islands or Guatemala and to the United States. It's easier, if we can, to do it right here in Belize City.
Mm-hmm. And Yvette, perhaps you can talk a little bit about planning for this year's clinics after all of the difficulties that were faced last year throughout the pandemic.
Well, that was actually a really interesting project to talk about. It was literally a project. First, I had to convince her, very wonderful friends, especially your esteemed Dr. Delaney, who has a very busy schedule, to consider delaying the clinic instead of, postponing the clinic instead of canceling it. So I had to sweet talk Dr. Delaney, and then I had to sweet talk the rest of his team. And they, of course, graciously said, absolutely. And Dr. Delaney was so kind about it. And as soon as COVID allowed, we set a schedule. And then we had to go to the Ministry of Health. And that was very difficult. And rightly so. I respect what the Ministry of Health is doing to try to protect Belizeans in this country. And so we had a very, very difficult time with the Ministry of Health in terms of convincing them that we could put together this clinic safely, and a lot of it involved things like the venue. So we are so excited about the collaboration with the Lions Club because we had to find an off-site venue. We could not be at the Carl Huchner. So Lions immediately agreed that was a very worthy cause, and they were happy to collaborate with us. And by the way, that's working swimmingly well, and we are all extremely pleased about the strength in unity that's happening to bring these clinics together for the children. We also had to find a venue in Dangrida, and Pelican Beach Hotel jumped in immediately, gave us 2 ground floor rooms to do 2 days of clinics down there. We have an appointment system. Patients cannot just show up, they have to call so we can slot them in and avoid having crowds. And of course, we have all the normal protocols. Having put that together, we went back to Ministry of Health and understanding the critical nature of this clinic. This clinic is not about, doing a little dental work or checking bones, which are important, or general wellness checkup. These clinics literally are life and death matter. And sadly, we've lost several children over this past year. And when I say lost, I mean they died. And that breaks our heart because our hands were tied. We could do nothing. And so just literally a week ago, Ministry of Health came back and said, okay, fine, go ahead with the clinic. So we appreciate so much everything that's going into it. Carl Huschner Memorial jumped in, lend us the examination, beds, and everything we need. So it's an extreme team effort. Every Rotarian has had to pitch in and do what they could to create rooms out of an open space. And as was said earlier, it's going well, but it was quite a bit of organization.
Yeah.
Reaching the patients was difficult because a lot of them changed their prepaid numbers. And so I'd like to take this opportunity to ask a mom or dad, if you know that your child was to be seen within 6 months or a year from a previous clinic, or if within the past 14 months a pediatrician told you that your child has a symptom that is potentially a congenital heart defect, please do not hesitate to call. We're willing to work late, and I speak for Dr. Delaney and his team, to ensure that every child that needs it is seen during this clinic. We cannot help you without the evaluation that Dr. Delaney kindly provides. So please call the number that is going to be shared, 610-3890, and we'll do our utmost to get you in.
Yeah, you do have to work on a schedule due to COVID protocols. I want to get into that in just a few. But Ariel, why don't you share with us kind of the behind the scenes mechanics, what it took to get this going and why it was so important for the club?
Well, this like I said, this is our flagship project, and we've been trying to get this project moving for months now. As Yvette was saying just now, the logistics behind it has been very complex, primarily because of the COVID pandemic. And so we've had several postponements, not only with this clinic here, but even with the clinics that we have with the surgery we have in Cayman, because we have patients in Cayman right now. That has been a logistical problem in itself. But in Belize, the executive committee of the Gift of Life has been working back and forth. We each have our own responsibility. Like Yvette just mentioned, she's the one who has been liaisoning with the doctors in the US. We have been here liaisoning with the Lions Club, for example, trying to get a location. We've been getting people setting up appointments, because right now, because of the COVID pandemic, it's all by appointments. And so it has been difficult, but we are so happy right now that it's finally happening. The children the parents are ecstatic that finally Dr. Delaney is here to shed some hope for them.
Yeah.
You should see. Pardon?
No, go ahead.
No, you should see the excited faces we have out there of parents and patients. And we have patients that we've been dealing with for a few years now, few months, and we even have new patients right now.
Yeah. Dr. Delaney, tell us about day one. It's been over a year since you've been here.
Right, and so that's exactly what Yvette and Ariel were highlighting, was that some of the children that we had slotted for surgery could not get out for surgery, and then they were denied when travel was released a little bit because their evaluation was too old. Mm-hmm. So we really had to get back down and get those kids rechecked and make sure they were still safe for surgery, or plan how they could be further evaluated. And so that's been really remarkable, and the Rotary and the Lions Club have done a great job of setting up both the space for us to work and the workflow, so that the kids can come in and we can see them and yet still do our due diligence to the COVID protocols and spacing people out and keeping everyone safe. Yeah. It's really been a remarkable team effort. And the kids that we've seen include kids that I've seen for the last 10 years that are doing extremely well. And we saw a number of children yesterday, brand new patients that have been waiting for us to arrive, that have complex heart disease, that will need to get further evaluated as soon as possible. So it's really been remarkable. The first day was an absolute success, and we're looking forward to the next several days to take care of as many kids as possible.
And the children that you saw last year who returned this year, has their situation worsened in that amount of time? Is it still where they can access treatment and improve quality of life?
It's both. Some of the children are stable and are doing fine, and we will work through the process to get them evaluated further. Some of the children have diseases that are severe, and the inability to get them out last year has impacted their health and their ability to get out this year because now they're higher risk. And when you're asking the hospitals around the Caribbean, Central America, and the US to take on patients that are much higher risk, sometimes you get told no. And then we just have to do the best with taking care of them medically and doing the best we can, because we understand the limitations. If we're trying to get a patient placed that could do very poorly, even with access to all the medical care they can provide, then they're likely to get denied. So we have to work with that very hard for all the kids.
Yeah. And Leroy, tell us about coordinating the treatment of the children internationally as well, and also getting the doctors to volunteer. I won't ask Dr. Delaney, I'm sure he'll be too modest about why he does this, but maybe you can tell us a bit, Leroy, about what it takes to get them on board.
It literally, all it takes is asking them.
Yeah.
I've not had any doctor or medical professional that I've asked for help to say, no, we won't help, because they're all committed. I think you heard Dr. Delaney say that he's been coming down here. I believe this is 11 years now.
Wow.
And prior to that, we had other doctors from Children's Hospital in Omaha, all committed to the program. In addition to the doctors, you have, there's a nurse that's with us, Jenny Strawn. Jenny's been down here, I think, for 20 years with me. And Maura Link is the ultrasound sonographer. They all take personal vacation from their jobs at Children's Hospital to come down and do this. Yeah. And it's not a question if they will come. They call me and say, do I get to go this year? So
wow.
It's easy to get people to say they'll help.
Yeah. And the access to care internationally, who covers the cost for that?
If they come to Omaha, it's our burden, the Rotary and the hospital. The Rotary Club of Belize City does an incredible job of raising funds to send kids, because they'll pay for the travel expense of the child and the parent. And sometimes there's a gift necessary to the hospital that's performing the procedure. So, but the Rotary Club of Belize City has makes an incredible effort to send these kids and get them out, and they raise the funds to do that for the travel.
Yeah, I guess, Ariel, that's your truck raffle and other efforts that you usually have ongoing?
Correct. And of course, I must mention, over the years, the Social Security Board has also been very generous with our efforts. Mm-hmm. They have contributed generously to us, making possible more assistance to these children. But yes, the truck raffle, which we have one coming up now, we encourage everybody to buy a chance to do so, because all of these funds go towards financing, like Leroy just said, travel for the parents and the children to different venues in the U.S. And I must mention also that in the U.S., when these parents go there, they are hosted by Rotarian families who take them into their homes, look after them, sometimes for weeks and months, and then send them back safely to Belize. A lot of these parents have never traveled before, and these host families look after them from the day they get there, after the surgeries, get them to the hospitals for checkups, get them safely back home to Belize. Yeah. So we must send out a kudos to these parents, to these host families in the US and Central America. And right now, presently, the Belizean Association of in Cayman is also doing the same right now. So we should recognize these good folks.
Yeah, very much a collaborative effort.
That's correct.
Before we lose the opportunity, Dr. Delaney, let's talk about some of the signs of cardiac problems in children, just in case parents are at home wondering if maybe they need to get a checkup.
Yeah, so oftentimes some of the things that you'll see in early childhood or when you have a toddler is poor growth, or weight gain despite a child that eats well. They just aren't able to put on weight like they're supposed to. That would make you suspicious that they're burning extra calories because their heart may be less efficient. Also a child that doesn't run and play like the other kids, that seems to want to rest a lot or pulls up short or seems to be short of breath. And then if the child is having color changes, where they either get pale or get a bluish hue to their skin when they're running around, then that can be a sign that there's an abnormal mixing of the blood in the heart, and that can be worrisome. Oftentimes there's signs when you take the child to the doctor. They could have a murmur that gives the doctor suspicion that something could be going on. And the doctor obviously can also check the oxygen saturation and other vital signs to see if something seems abnormal. And we get a tremendous number of referrals in from the local pediatricians and family practice doctors that have evaluated the children first and have been suspicious of heart disease and have sent the children on to us. And that's where we get the vast majority of our patients.
Okay. Yeah. And so in this particular clinic, this time around, you're doing follow-ups. Is it also open to new patients?
Both, absolutely. Yeah. We see the kids that we already know, and we absolutely want new children that parents are concerned about or that the doctors have been concerned about to call the number that Miss Yvette and Ariel have mentioned and find a time to come in. We'll obviously see every kid that needs to be seen before we're done this week.
Yeah. So Yvette, let's talk about coordinating those visits. As you said, it's not an open clinic. People can't just show up. Because of COVID protocols, there has to be a new system in place. Give us the details.
Yeah, so we reached out to as many of the known patients as we could. We have communicated with all the pediatricians we could and let them know that the clinic was happening. We didn't advertise ahead because I should mention that on our regular Belize days, we will see over 60 patients in one day. And obviously those patients come with their mom and dad and siblings, and so we're talking about a crowd. We couldn't allow that to happen. So we've been very specific with appointments, but we do have open slots because we anticipate that there will be a few patients that we couldn't reach because of a change of prepaid number or brand new patients who doctor told them that the child might have a problem who didn't know this clinic was coming up. So we are encouraging them, asking them to please call 610-3890 and we will slot them in. If they're willing to come, if they're willing to wait a little bit if it's necessary, because sometimes it runs a little bit late, we will work until we see the last patient. But we can't just have them all show up at the clinic at 8 o'clock and have 60 people waiting outside. So it's important for them to call first.
All right, and you are also going to be in Dangriga.
Yes, so we'll start in Dangriga from 9 o'clock on Thursday morning. We'll be at the Pelican Beach Hotel. Again, kudos to Pelican Beach for giving us the 2 rooms for the evaluation. And we already have appointments set, so it's the exact same thing. It's important for them to call ahead so that we can slot them in at a time when it won't be crowded. But we'll be there on all day Thursday and Friday as long as we need to be. We still have some appointments open Friday morning, but we will definitely see every patient from every corner of this jewel whose parent is willing to come out and take the child through the process of being safely evaluated by Dr. Delaney.
All right. Well, we are just about out of time for this segment, but of course we want to say thanks to all of you for coming in and sharing information all about this really, really great and vital initiative. So to all of you, thank you.
Gavin, may I say something?
Thank you. Thank you very much.
Thank you very much. But may I say something? I need to say this. Ariel said, buy a raffle ticket. I have a problem with that. I say, donate $100 to this and all our other fabulous causes. Donate that money because we all know only one person can win that truck. But with your kind donation, it helps us to continue to do this and so many other things for the Belizean public. we'd like to thank all of you Belizeans, because everyone who does support our fundraisers directly support one of these children we're serving this week and all the other people in the community we so happily serve. Thank you.
Well, thank you, and thank you for joining
Thank
us.
you very much. Catch Channel 5.
All right. And,
Okay, have a nice day.
and stay safe, everybody.
Thank you.
Thank you.
All right, with that, we're going to go ahead and take a break.
And when we come back, we're going to be talking about what we can expect from the weather as we move into the later months of the year. So we'll just take a short break and we'll be right back. So please stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.